Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. I am a board certified internal medicine physician, and it is my pleasure to basically discuss various health topics in order to improve one, health literacy, as well as to improve wellness. And it is my passion to educate common folks such as yourself regarding topics to promote wellness. And today I want to discuss the topic of abdominal aortic aneurysm. This is a disease that is typically asymptomatic, meaning this disease typically does not present with symptoms, or patients typically do not have symptoms when diagnosed with this disease. However, when you are symptomatic, or when you do have problems or symptoms because of this disease, it's typically a catastrophic event. It's typically at the point where now we're worried about the overall health of the person and or mortality. In fact, the overall mortality when this disease becomes problematic is over 80%. Basically mean 8 out of 10 people essentially die from a complication of this disease once it's problematic. And so therefore we screen for this disease. Screening for asymptomatic diseases that can essentially cause death is very important, and it's something that I want to bring awareness of. And so that's why I want to talk about abdominal aortic aneurysm, because it is an asymptomatic disease that can be fatal. So therefore, let's get into it. So this disease is or has the acronym of AAA or AAA. All right. And so when somebody say I have a AAA, that means they have a abdominal aortic aneurysm, not the AAA that we are familiar with for the roadside service. It's not that. This is a disease that can cause catastrophic problems. All right, so the first A is abdominal. So we're talking about the belly area, the abdominal region. So that's near your belly. And aortic, that's the second A. That's a major blood vessel that originates from the heart and essentially descends or go down towards the belly, go past the belly into the leg region and bifurcate or split once it reached the leg region. All right, so aortic is a large blood vessel that comes from the heart. And then the last A is very important. It's aneurysm. All right, aneurysm. What is that? What does that mean? So aneurysm is basically an enlargement, a localized enlargement of a artery, so of the aorta, which is an artery, because maybe the wall of that artery has become weak. All right, and so we think of it as an enlargement of a weak wall. The way I think of this, I don't know if you guys ever had a ball. I remember, I grew up poor. I'll just be frank. I grew up poor, essentially. And so we used to have a basketball, and when that basketball gets worn, even footballs, it gets worn. And when that basketball or football is worn, when it has a bulge on the side of the ball. That bulge, we used to call it a titty, essentially. And so I think of a aneurysm similar to that. It's a bulging. And it's basically that ball, the wall of that ball gets weak and it starts bulging out. And so that's what happens to the artery. And so the aorta is the same thing as saying artery. So remember, abdominal, the first A, aorta, artery, same thing, aneurysm. There's a weakness and there's a bulging of that artery, and it's called an aneurysm. Now, the reason why this disease is catastrophic is because that weakened part of the artery, that bulging, it can rupture. And remember, this artery is coming, it's a major artery. Think of a major highway. It's coming from the heart and it's branching down, and it's various different arterial branches that's branching out from this main artery. So the aorta is just a major artery. and it's a lot of blood basically a lot of blood that's within this artery that's feeding the rest of the body. So it's a large capacity artery that carries a lot of blood. And so what happens is when that aneurysm rupture, when that weakened point rupture, you lose a lot of blood. And that's how people die almost instantly. Basically, they bleed out quick. It's just like if that bulging effect on that ball, if that bulge ever pops, the ball flattens. And that's essentially what happens. You lose a lot of blood, and that's why the mortality is high. You die. All right? And so that's why it's important to talk about this, is because it can be fatal. All right? This is a fatal, fatal, fatal disease if we don't do anything about it and just let it go on. All right, and so let's talk about the risk factors. Who are at risk of this disease? I told you what happened. We want to talk about the risk factors. Who does this disease mainly affect? And then we're going to end with screening. How can we screen for this disease to prevent this from happening in the first place? So what are the risk factors? The major risk factors, you have three major risk factors. Men, if you are a male, we see this disease more commonly happen in males. It's more so a male predominant disease. All right. So if you're a man and you're older than 65, this is a older than 65-year-old disease as well, and you smoke. All right. And what I mean by smoke, if you are between 65 and 75 years old and you're a man and you have smoked at least 100 cigarettes in your entire life, then you are at risk of this disease, abdominal aortic aneurysm. And therefore, we'll talk about the screening later, but it's very, very, very important that you get screened for this disease. What are other risk factors? Well, it turns out the reason why people have or develop this weakness of the aorta or this artery, the reason why this vessel essentially becomes weak is because of pressure. All right, so high blood pressure within this system can essentially cause the walls to become weak because there's a lot of pressure within this closed system. Remember, the artery is a vessel, which is a tube, and it's a closed system. It's a closed tube, and you're applying pressure within this closed tube. It can actually put pressure on the wall of the tube, the wall of the artery, and cause it to be weak. What else could cause this artery to be weak? Atherosclerosis, fancy way of saying plaque, fancy way of saying cholesterol, building up within the wall of the artery can cause the artery to become weak. And when you add pressure to that system, along with the atherosclerosis, then you get problems. And so other risk factors, high blood pressure, high cholesterol. If this runs in your family, maybe somebody in your family, first degree relatives, mom, dad, brother, sister, may have had an aneurysm, abdominal aortic aneurysm. All right. And maybe you are now genetically predisposed to having a weakened arterial wall. That put you at risk. So family history is very important. Other vascular aneurysms. Maybe you not have an aneurysm, or maybe you yourself had aneurysms in other places. Maybe in your brain. Some people have brain aneurysms, for example. All right. And so if you have a history of aneurysms, then, obviously you're at risk for other aneurysms in other parts of your body. And also being obese is a risk factor because it put you at risk for atherosclerosis, essentially. All right. And so these are the risk factors. And so with these risk factors, the United States Preventive Services Task Force gives us screening recommendations when and how you should be screened. All right. And so if you are a man, age 65 to 75 years of age, and have smoked at least 100 cigarettes in your life, you should be screened or evaluated for this disease. Remember, you don't have to have symptoms. This disease in its infancy is asymptomatic. People are walking around right now with abdominal aortic aneurysms and they don't feel anything. That's the danger of this disease. All right. So that's why you should be screened. Okay. And so the next question is, how do we get screened? Well, we just do an ultrasound. We It's non-invasive. We put a probe, which is a handheld device, near or on the abdominal aorta, and we assess it through ultrasound imaging, the level of the diameter, to see if you have an aneurysm, and if so, how big it is. How big is the aneurysm? And that will let us know if we should do an intervention. And now the interventions to fix this problem are minimally invasive. Okay, it's not a big surgery how it used to be for some people. And so the screening is non-invasive, painless, very easy, and the intervention to fix this problem is also minimally invasive. All right. And so that's why screening is important. It's because, one, if you have it, you won't know you have it unless we look for it. And if you do have it and we learn that you have it, it could be too late. It could be catastrophic. It could cause you to die. And two, screening is painless. It's non-invasive. All right. It's not going to cause you any pain. And three, if you do have it, we can do something about it right away. So that's why it's important to screen for it. All right. And so that's my time, but I want to recap. AAA, abdominal aortic aneurysm, is a fatal disease, easy to detect by screening, easy to treat with our minimally invasive interventions. A lot of people are at risk, and so that's why we should talk about it. And we should save lives by talking about it amongst each other. The major risk factors: being a man, being over the age of 65, and having a smoking history. All it takes is 100 cigarettes in your life to be at risk. There are other risk factors: high cholesterol, high blood pressure, being obese, having aneurysms in other parts of your body, having a family history of this. All right? Okay, guys, remember, our health is our wealth. Our health is the way our family continue to love on us. Our health is how we are able to continue to love on our families. Be healthy, be well, do the things we need to do to stay healthy and stay well. I love you guys. Until next time, peace. Like and subscribe.